Rehabilitation centers are noticing COVID-19 patients may experience health consequences even after they've recovered from the virus. 23 ABC's Daniela Garrido joining us live this morning after talking with the Center of Neuro Skills on what they've seen locally. Daniela?
That's right. Good morning. Well, imagine recovering from a virus such as COVID-19 only to realize you now have underlying health conditions from the treatment. That's what the Center of Neuro Skills is telling us that they are seeing here, as they're seeing more recovered patients come to them after they've recovered from the virus. The Center of Neuro Skills in Bakersfield has seen a number of recovered COVID-19 patients since the start of the pandemic.
And because the emphasis during the hospitalization is really appropriately on saving their lives and supporting them from a cardiopulmonary standpoint, what we're seeing is that at times these other types of injuries like anoxic brain injury, small subtle cognitive impairments, some of these swallowing problems or other speech problems aren't really necessarily being identified until a more thorough evaluation looking specifically to address these types of issues is undertaken.
The center focuses on helping patients recover from post-traumatic injury in order to help them get back to living their life as normal as possible.
We are seeing these patients starting to come through as on the tail end of their hospitalizations and their subsequent recovery. And really, our mission is to help people, put their lives back together from traumatic brain injury, stroke, any other form of acquired brain injury. And this subset of people is really just another group that we are glad to be able to be present in the community and help.
The American Speech, Language, and Hearing Association reported in July that COVID-19 patients who have spent time on a ventilator may experience communication challenges, swallowing disorders, and cognitive problems even after recovering from the virus.
Some people who have COVID-19 actually suffer a neurological injury as a result of that. And coincident with that, they can have speech problems that require speech therapy. And then there's also consequences directly related to prolonged ICU courses, prolonged periods on mechanical ventilation or being intubated. And because of that, they can have specific mechanical problems with their airway that can occur.
According to Dr. Matt Ashley, there is no set time on a ventilator that would cause or prevent these post-traumatic injuries from happening.
There is a subset of people who are experiencing other problems that are related to COVID-19, such as stroke, or people who've had respiratory failure or cardiopulmonary arrest can suffer injury to the brain from a lack of blood flow, and that's called hypoxic or anoxic brain injury. And so those two things can also produce speech problems that require speech therapy.
Now, Dr. Matt Ashley also recommends you seek help if you notice changes in your speech after recovering from COVID-19. He also says the center can help you with individualized therapies to make sure that you can get back to society and work. For now, we're live in Bakersfield. I'm Daniela Garrido, 23 ABC News, connecting you.